Good evening. This is Ed Ullmann, pharmacist on the lovely mountaintop of the community of Tannersville, New York. I've been trying to do my best to give you a weekly update of the coronavirus. And last week was a little stunning. This week has been a little bit more sobering, but certainly as dangerous. All Americans, especially New Yorkers, have now experienced the pain and fear associated with social distancing or our national effort to slow down the spread of the coronavirus. People are being separated from their workplaces, from friends and loved ones. Every person will adapt to this differently, and it's going to be especially tough on our folks, our friends who have trouble with fear and dealing with stress to begin with. Let's be patient with them. We also now are seeing the ultimate community sacrifice. Probably we have not seen this since World War II. In reality, what we're trying to do is to try to buy time until our medical system can catch up as we flatten the curve and we cut off chains of transmission. This is the intelligent thing for our nation to do, and I totally support it. And to be clear, as a nation, we have made a policy decision to put the health of the people ahead of the economic fallout that is just beginning. This will go down as a special moment in American history. Here are some updates from the past week. The President issued a federal disaster declaration for New York State, which will now allow us to have FEMA come in and to help the state financially. New York State was declared the national epicenter for the coronavirus with 50% of all the cases in the nation. New York City had 56% of all the positive cases in New York State. So we're dealing with a very, very aggressive stand in New York City and a terrible, terrible situation that is going on right now. Of special interest to me was that the age group 18 to 49 are now testing 50% of the positive tests are in that age group. This is not just senior issues. This is now all of us. New York State has responded very aggressively, and I think that the governor has done a very good job in trying to reach out to protect us. Temporary hospital sites have been set up. A U.S. hospital ship is coming with 1,000 hospital beds very shortly. All the hospitals in New York State have been asked to increase their capacity, their bed capacity, by at least 50% to meet this challenge. This is throughout the state of New York. And now all non-critical elective surgeries in the state have been canceled. Testing for the coronavirus finally is starting to accelerate all across the state. We see it at the hospital levels. We're seeing it now in road testing, and we're doing the best that we can to increase the amount of daily testing and to get it to the labs so we can get results. We're now also seeing that out of all the people who are being tested in the state, about 15% are coming up positive. And out of that 15%, the majority have no signs, no symptoms, but can be dangerous carriers of the disease. Worldwide, this morning, we had close to 510,000 cases that have been reported, and there's a death or a fatality rate of 4.5%. That's been holding about its own. And some studies now coming out of China on evaluation of the death rate is suggesting that China was much lower, maybe in the 1.5 to 2.5 range. Italy remains the hardest hit country in the world with a incredible fatality rate that's coming close to 10%. Iran is next with a fatality rate of 7.2%. In the United States, we now have 75,000 plus reported positive cases with a fatality rate of 1.4%. An amazing New York State is averaging 1% fatality rate, and this is 2 weeks in a row. Greene County, here at home, we've reported 8 confirmed positive cases, and 32 individuals are now being self-monitored for possible exposure in the county. The U.S. infectious disease expert, Dr. Anthony Fauci, has stated that it can take up to 2 weeks to show symptoms after an individual has been infected with the virus, and that he's seen that there's been no change in how the virus performs. So it's been fairly consistent. 8 out of 10 individuals remain with mild or no symptoms at all. Our infants and our young kids appear not to be having a major impact. But as he said, that the virus could mutate and change at any given moment. The president will soon sign into law a $2 trillion stimulus package, the largest in American history, to help those suffering from the epidemic and to help stabilize our economy. It appears that about 2/3 of the funds will go to lower and middle income families in America in the form of unemployment insurance and single payments. It looks like at $1,200 per single, $2,400 per couple, $500 per child. And the payments are anticipated to be released to the public last week of April, the first week of May. We also know that this bill will provide loans to corporations and to small businesses. And the prime goal, especially from the workforce, is to try to keep employees employed. Even though they might be at home, we need to keep them on the payroll because we know that a skilled workforce is critical for us to get back into the action and our economy going again. And we don't want individuals losing the spirit, going on unemployment, and then those businesses, when they get back running again, now have to recruit all new individuals and new skills. That's the goal, to try to keep individuals so that they can maintain some sense of decency and to pay for essential services and then get back to work when the economy is ready. We know that the coronavirus is going to remain a work in progress. Every day something new is discovered about its characteristics or treatment options. Experts that you've been hearing are now looking at the HIV antiviral drugs, and now they're looking at this new combination of an antimalarial drug, the hydroxychloroquine, and the antibiotic azithromycin, which in combination might have promised as a treatment. So what can we do to be prepared? Let's go in forward. Obviously, we got to continue to follow the conventional wisdom for prevention. We need to continue to understand that one sneeze can turn around and circle 6 feet around us. That's why the recommendation that we have 6 feet of distances between each other. We also know that by now we must combat viral infections with a strong immune system, antiviral drugs, and antiviral natural products. As I've said in the past, our immune system is very magical. It is designed to produce white blood cells whenever a potentially dangerous germ enters into our system. The stronger the immune system, the stronger the defense system against a germ. That's what we're trying to hope that we can do with the coronavirus. We don't know, but we believe if you can have a stronger immune system, you can work within that first 48 hours and maybe have a greater defense system. We also know for an immune system, you have to have the combination of your diet and hydration and stress management and exercise and supplements. For daily supplements, we continue to recommend a high-quality probiotic. We continue to recommend products that are antiviral and strong immune building. Mushroom tinctures, especially the reishi and the shaka, we think is very critical and been very helpful, and the tests that we're seeing now is holding that up, especially for the potential for the coronavirus. We also recommend elderberry tonic. Both of these are safe for children and adults. We continue to recommend 500 milligrams of vitamin C throughout the day, 2,000 international units of vitamin D, about 50 milligrams a day of zinc and echinacea. We now also recommending, it's called quercetin, and that's spelled Quercetin. This is holding up to also have excellent antiviral potential, and it'll be 1 capsule twice a day, and also as an immune booster. If your family member does come down with the flu, I just want to try to give you the best advice that I can. Take the mushroom tincture, increase it to 3 times a day. Take vitamin C, increase it to 1,000 milligrams every 4 to 6 hours. If your body has too much vitamin C, you will get diarrhea. That's your defense system. Back down, take less, but continue to take it as a strong antioxidant. We also recommend that you take 1 teaspoon of 500 ppm of colloidal silver twice a day for 5 days. Now, I want to just make one observation about colloidal silver. I understand, like all natural products, there is no FDA testing on these products. We look to Europe, and they do have testing. We do look to other parts of the country. But what I looked for in colloidal silver is, what do my patients tell me? What do I observe? And I have observed the use of colloidal silver now for over 5 years for close to 300 to 400 different patients, and we have had excellent results. It is an excellent germ killer, and until otherwise, that's why I recommend this as a potential germ killer that could help to retard coronavirus if you get it. Now, one other thing that we are finding out, if you do get the virus with elderberry tonic. Elderberry, one of the positive things is that it helps to trigger, it's called cytokines, and cytokines help the immune system to kill germs. In this particular case, we think that elderberry in the increase of the cytokines might not be positive if you have coronavirus, so we're recommending that you do not take it at this time. We do, though, however, recommend increasing echinacea as an excellent antiviral and a immune booster. The next weeks and months will continue to be challenging for us. Like many of you, I keep wondering, how were we so unprepared for an epidemic like this? Now, I got this quote. It's from the Global Health Security Index. It said America was listed as the #1 nation in the world to be prepared for a pandemic. #1 in the world. Instead, we got caught with our pants down, especially with our testing, that would have allowed us to quickly identify people with the virus, isolate them, and then start to trace those that they had contact with. Now, without this early testing capability, all right, we just prevented our hospitals and our integrated healthcare systems from being able to implement their own pandemic plans. And now we're forcing the hospitals and the governments to compete against each other for needed supplies. It's these supplies that are on the market is going to the highest bidder. This is wrong. And we've got to get our hands on this and hopefully learn in the future. This is not a pretty picture, as we know. Now, on the positive, I have been extremely happy to see the private sector come together with the public sector and say, let's roll up our sleeves, let's get this supply chain under control, and let's get it done. And I think we're going to see excellent results. I want to just say that my main concern, as I look back and I'm going to first look as a health professional. I know how stressful this has been for myself and for many others. We go home at night and we're tired. But this is nothing like what we've been asking our health professionals, our doctors, our nurses to do, especially in the epicenter of New York City. These brave men and women are going to work, working long hours. They are in such shortage of masks and supplies to keep them healthy. They're doing the best that they can. Some of them are being asked to use 1 to 2 masks all day long for their patients. And they're doing it because that's what they signed up to do as health professionals. This represents the best of America. This is the best of who we are as Americans. And I want to add to that all the ordinary Americans, the people in our communities that come up and say, how can we help? How can we be in this together? We are proud Americans, and together we're going to get this done. It is a beautiful thing to see, and I'm not the only one experiencing this. We all can see it, and God bless us. I wanted to say at Wellness RX, we're going to do our best to keep you informed in as much of an honest way that we can to try to protect you. We're offering curbside service. You just knock on the door or give us a call. We bring the medications out to you. We're trying to answer as many phone calls that we can of questions that you have. We are trying to treat everyone equally. We are trying to keep our facility clean all day long. We are doing what we can to be part of the solution, and I'm very proud of the staff. They are just gutting it out to do the best that we can, and we are just watching and following the example of everyone else, including all of our local public officials, our local health professionals, our leaders in the public health department, our emergency transporters, the individuals who are there when there's the emergencies on the road. All of us are working together, and you know something, we're going to get it done. And we're going to get back in the game as a nation. We're going to get our economy back. And then we're going to look back on this. We're going to be stronger and more powerful than ever. But we're going to learn that we will be prepared for another epidemic like this in the future. Good night. Rest.